So my name is Kim. I am a CT technologist here. We do lung screenings. Lung screenings are for individuals who are smokers for 30 years or more, have smoked a pack or more a day. They're also for smokers who have quit for the last 15 years. We do lung screenings with a CT scanner. This is one of our CT scanners. It's a GE scanner. What would happen would be a patient would come in, they would register, they would fill out a questionnaire for us, and then we have a questionnaire specific to the lung screen. We bring them back. We actually lie them down on a table, just like this. They're going to be very comfortable, head on a pillow. We have a little sponge for their knees. They go into the scanner 3 times. Whole process takes roughly 5 minutes. One of the things that patients confuse a CAT scan with is an MRI. People who are claustrophobic do not like MRI scanners because they're long tubes. CAT scans are a donut, you can see. So you stick out on both sides. Your head sticks out here, your feet stick out on the other end, and you never go through it. You go into it and then you back out. And it's very quick. The scan literally takes less than 3 minutes to do. And it's painless. There's no needles involved, nothing. You just lay there and think happy thoughts. With a lung screen, we want to look for any kind of lung nodules, any kind of masses, abnormalities in the lungs that we could attribute to smoking. When you find them and you find them early, then you can, obviously, if it's cancer, you can treat it early, you get better results. If they're lung nodules, then we just follow up with them yearly. Lung nodules are very common in the greater Cincinnati area. And most of the time, lung nodules are nothing to worry about. Occasionally, you'll get one that is something to worry about, in which case, the earlier we find it, the quicker we can treat it. Ages are 55 to 79, and if you meet all of the qualifications, it's recommended that you get a lung screen. After your scan is complete, a radiologist gets all of the images and all of the information. That's the patient history, the questionnaire, and then the radiologist will interpret the images and then send the results to the ordering physician. You get your results back in 24 hours. Come in for your lung screen. We'll get you in and out really quick. It's painless, and it's good for you.
You know, the United States Preventive Service Task Force has recommended a low-dose CAT scan for people who are at risk for lung cancer. And who is at risk? If you're aged 55 to 77 and smoked for 30 pack years or more, and maybe even quit 10 or 15 years ago, you're at risk for lung cancer. It's important that you do your due diligence. Ask your primary care physician about the new lung screen procedure that has been approved by Medicare and other insurances. It's important that you do this because if you have lung cancer, it has been discovered and determined that there are 20% fewer deaths from lung cancer for those who have been screened by this low-dose process. What it is it's 3 years in a row you do a low-dose CAT scan. It's not any risk for you to have any other diseases. It is strictly just to diagnose lung cancer at its earliest stages. So if you're a smoker, get the new lung cancer screening process done. And if by chance you're diagnosed with cancer, it'll be early detection. Early detection matters. And then we'll see you next year at the 10th Annual Black and White Cancer Survivors Gala as a new 1-year survivor.